Hello, my name is Dr. Dewan S. Raja. Today I will discuss about narcolepsy. What is narcolepsy? Narcolepsy is an uncommon sleep disorder. It is present around 0.04% population. So 0.04% population have some type of narcolepsy. It is characterized by uncontrollable episodes of daytime sleep, cataplexy, often incited by emotional responses like love, anger, hallucination, that is false sensory perception during sleep, at the beginning of the sleep, at the end of the sleep. One is hypnagogic, another is hypnopompic hallucination. Disturbed sleep. Sleep is not sound sleep, it is broken. Sleep paralysis during sleep at the beginning or even at the end. Person cannot move his or her limb. Everything in his body seems to be paralyzed. Recurring rapid eye movement intrusion during stage 1 sleep, and disruption of sleep-wake cycle. So we got the term cataplexy. Cataplexy means sudden onset of muscle weakness. It may be entire body muscle weakness, maybe partial weakness, maybe part of the body weakness. Types: narcolepsy type 1 with cataplexy, narcolepsy type 2 without cataplexy. Another type, narcolepsy due to injury to the hypothalamus by head injury, by tumor or cyst or parasitic infection that may damage the hypothalamus. There is the third type of narcolepsy. Epidemiology: it may happen to male or female, any racial background. The male to female ratio is 1:1, usually during the early adult life, around the 15 to 35 years. But any year, the patient may be of any years, not necessarily early adult. A lot of them may have family history. There is some gene identified, but that may not always cause narcolepsy. Role of orexin neuron in arousal and wakefulness. This part has been taken from Guyton's Physiology. It says that orexin, also called hypocretin, is produced by neurons in the hypothalamus. Hypothalamus is the part of brain that is just above the thalamus, in continuity of the thalamus, that provide excitatory input to many other areas of the brain where there are orexin receptors. Orexin neurons are most active during waking and almost stop during slow wave and rapid eye movement sleep. Loss of orexin signaling as a result of defective orexin receptor or destruction of orexin producing neuron causes narcolepsy. So it may be damage to the receptor, it may be damage to the particular neurons. A sleep disorder like narcolepsy, characterized by overwhelming daytime drowsiness, sudden attack of sleep that can occur even when a person is talking or working. Patients with narcolepsy may also experience sudden loss of muscle tone, cataplexy that can be partial or even severe enough to cause paralysis during the attack. This observation points to an important role for orexin neuron in maintaining wakefulness, but their contribution to the normal daily cycle between sleep and wakefulness is unclear. So if a person is cataplexic in front of other people, he may injure himself or he may be frustrated due to cataplexy. Okay, what are the causes of narcolepsy? The exact cause is not known. It is multifactorial: lack of orexin, hypocretin, a neurotransmitter from the hypothalamic neuron. This lack of orexin may be due to destruction of the neuron of the hypothalamus or alteration or damage to the receptor other than the hypothalamus for the hypocretin or orexin. Okay, so that may happen. It may be an autoimmune mechanism that may destroy the receptor or the neurons, and that may work on the sympathetic and parasympathetic system also. Genetics has some role. The gene is identified, but its action in the causation of narcolepsy is not well established. Imbalance dopamine and serotonin, these are the neurotransmitters like orexin. There's imbalanced dopamine and serotonin that may the reason for cataplexy. If we go to the symptom again from our Google image, by World Narcolepsy Day, excessive sleepiness, cataplexy, sleep paralysis, then disrupted nighttime sleep, then hallucination, it may be hypnagogic, maybe hypnopompic, okay, and brain will be foggy, okay. Diagnosis and assessment of narcolepsy by clinical evaluation. To remember that narcolepsy should be excluded if a person has history of substance abuse. So according to the definition of narcolepsy, it is not this morbid sleepiness not due to taking any drug or substance abuse. Sleep studies, polysomnography, and multiple sleep latency testing. CSF study for hypocretin. Screening for substance abuse. Substance abuse will exclude the diagnosis of narcolepsy. Treatment of narcolepsy, there is no cure, we have to accept that. Consult with a licensed physician, that is very important. CNS stimulant, okay, like amphetamine or amphetamine-like medication, antidepressant like selective serotonin reuptake inhibitor, or another antidepressant imipramine. Modafinil, this non-amphetamine stimulant, should be taken in the morning on an empty stomach. Pitolisant, another medication, okay, that work on the histamine receptor. It is both agonist antagonist in the same place, and it work good in the prevention of daytime sleeping. Amphetamine, dextroamphetamine, Adderall, okay, this is CNS stimulant, okay, and sodium oxybate, this is actually CNS depressant. It is used at night time. A lot of abuse with this drug. People may do the date rape with the sodium oxybate, okay. It should be taken 2 times in a night, okay. It helps improve sleep quality at night and prevent cataplexy. Daytime short nap may be workable to some person, maybe 10 to 15, 20 minutes nap may overcome the morbid sleepiness. Sleep discipline is very important. Sleep should be in the particular time of the night and particular duration, and hygiene. The sleep area should be comfortable, cozy, without any noise. Physical exercise, just like walking 2, 3, 4 miles daily, may overcome the problem of narcolepsy, and it can prevent it. Okay, lifestyle modification also important. Not to take too much heavy meal before going to the bed, not to take alcohol or caffeine too much. Okay, and we are seeing at the key possible symptom: excessive daytime sleepiness, sudden muscle weakness, that is cataplexy, sleep related hallucination, that may be hypnagogic at the beginning, hypnopompic at the end of the sleep. Okay, two type of hallucination. Hallucination is the false sensory perception. Sleep paralysis, maybe at the beginning, maybe at the end, person cannot move the limbs. Then how do I take care of myself? Be consistent with your sleep habit, make the time for sleep. Physical activity can help, like walking like her, have a nap, and make an appointment to see a physician to discuss the symptom. This medication should be prescribed by the licensed physician. Have a nap. Avoid alcohol, caffeine, tobacco, eating meal too close to bedtime. That is also important. Okay, so this is like the daytime sleep, short nap, sleep discipline, physical exercise, and lifestyle modification. And that's all about the narcolepsy. If you have any question about narcolepsy, please feel free to ask me. Please share the information with your friends. And have a nice, wonderful, and blessed day.